Worldwide, blood types are classified into 8 main groups using the ABO and RH systems, including the blood types O positive, O negative, A positive, A negative, B positive, B negative, AB positive, and AB negative. Among these, blood type O positive represents 37% of the global population. Blood type O negative 6%. Blood type A positive 34%. Blood type A, negative 6%. Blood type B positive 10%. Blood type B negative 2%. Blood type AB positive 4%. Blood type AB negative 1%. As you can see, O positive is the most common blood type, while AB negative is the rarest. The distribution of blood types in some countries around the world. In the United States, the most common blood type is O, accounting for 44% of the population, followed by A at 42%. Blood types B and AB account for only 10% and 4% of the population, respectively. In Germany, as many as 37% of the population have A positive blood type, while the rarest type, AB negative, is found in only 1% of the population. Indigenous people in South America predominantly have blood type O. For example, in Ecuador, as many as 75% of the population have O positive blood type. Blood type B is very common in India, where it accounts for 40% of the population, as well as in other South Asian countries. For example, in Vietnam, 31% of the population have blood type B. Blood type distribution is not random. It is a biological record of how humans adapted to disease. In regions with long-standing malaria endemicity, such as Africa and the Americas, blood type O is more prevalent. Historically, individuals with blood types A, B, and AB are believed to have had relative survival advantages during outbreaks of plague and cholera, while those with blood type O were more vulnerable. Studies from Tokyo Medical University in Japan have found that men's blood types affect their risk of developing cancer and their likelihood of recurrence after treatment. A study conducted on 555 prostate cancer patients showed that men with blood type O have a low postoperative recurrence rate, while those with blood type A have the highest recurrence rate, up to 35%. Scientists believe that the antigen-antibody structure of each blood type affects disease risk, treatment effectiveness, and the likelihood of recurrence. Blood type A has high blood viscosity, which is an important factor contributing to cerebral infarction. Migraine patients with blood type A always have higher blood viscosity than those with other blood types. On the other hand, high levels of triglycerides and blood cholesterol are also reasons why people with blood type A are more prone to cardiovascular diseases. In addition, blood type A is believed to be more prone to stress than other blood types because they have higher than normal levels of cortisol, a stress hormone secreted by the adrenal glands. Clinical statistics show that people with blood type A have a higher risk of developing stomach, tongue, and esophageal cancers compared to other blood types. If people with blood type A experience upper abdominal pain, vomiting, bloody diarrhea, or other symptoms such as gastritis or stomach atrophy, they should see a doctor as soon as possible. People with blood type A are advised to be tested for H. pylori once in their lifetime or when symptoms appear. Increase the intake of foods that protect the stomach lining, such as turmeric, garlic, green tea, broccoli, and ginger. People with blood type B tend to be strong, energetic, highly creative, and ambitious. But they are more prone to diabetes than those with other blood types. A study of 80,000 people in France showed that individuals with blood type B have a 21% to 35% higher risk of developing type 2 diabetes compared to those with blood type O. The reason, as identified by scientists, is that the blood type B antigen may affect insulin activity or inflammatory responses in the body, increasing the likelihood of insulin resistance. Some countries where people with blood type B have a high rate of diabetes include Thailand, India, and China. These are all nations where blood type B is common in the population. In addition, According to the U.S. National Cancer Institute, blood type B is associated with a 50–70% higher risk of developing pancreatic cancer compared to blood type O, depending on the study population. The reason is that the gut microbiome of people with blood type B has a distinct structure, and the gene that determines blood type B may also affect how pancreatic cells respond to inflammation. People with blood type B are advised to have their blood sugar checked annually if they are over 30 or overweight. People with blood type B should prioritize foods such as fish, eggs, lean meat, green leafy and cruciferous vegetables, yogurt, walnuts, and low-sugar fruits. People with blood type AB tend to have a relatively calm personality and quick neural responses. However, a study from the University of Vermont, USA, which followed more than 30,000 Americans aged 45 and older for 3 to 4 years, found that people with blood type AB have an 82% higher risk of experiencing cognitive problems and memory decline compared to those with other blood types. According to American scientists, the reason is that people with blood type AB have significantly higher levels of protein, 8A clotting factor, compared to other blood types. High clotting factor levels reduce blood flow to the brain, increasing the risk of cognitive impairment and memory loss. It is recommended that people with blood type AB have their blood lipids tested once a year and monitor their blood pressure regularly. They should sleep 7–8 hours a day and avoid prolonged stress and sleep deprivation. People with blood type O have strong vitality and a highly active metabolism, but they are at increased risk of developing stomach ulcers, duodenal ulcers, and blood clotting disorders. According to Yale University in the United States, people who have Helicobacter pylori, H. pylori, are more likely to develop pancreatic cancer, as the A and B antigens help the bacteria thrive. Meanwhile, people with blood type O do not have antigens on the surface of their red blood cells, so their risk of developing pancreatic cancer is lower than that of other blood types. However, people with blood type O have a 1.5 to 2 times higher risk of developing gastric and duodenal ulcers compared to other blood types. The main reason is that Helicobacter pylori, H. pylori, can adhere to the stomach lining of people with blood type O more tightly and easily than in those with blood type A or B. In addition, people with blood type O are also at higher risk of bleeding disorders, difficulty stopping bleeding, when experiencing injuries or undergoing surgery. The reason is that people with blood type O have levels of von Willebrand factor VWF and factor VIII proteins that assist in blood clotting that are about 25–30% lower than those of other blood types. This helps reduce the risk of blood clots, but makes it more difficult to stop bleeding. Another study of 20,000 people by the University of Pennsylvania, USA, found that people with blood type O and carrying the ADAMS7 gene have a lower risk of developing cardiovascular diseases. This could help develop new therapies for people at risk of heart attacks by mimicking the benefits of the gene in individuals with blood type O, said lead researcher Dr. Muridak Riley. People with blood type O are also believed to have a lower risk of dying from malaria compared to those with other blood types. It is recommended that people with blood type O inform their doctor of their blood type before undergoing tests or surgery. People with blood type O should supplement vitamins C and K by consuming foods such as leafy greens, broccoli, and other vitamin-rich vegetables. General recommendations for all blood types. Engage in at least 150 minutes of exercise per week, as this has been shown to reduce the risk of blood clots. Drink enough water, 1.5–2 liters per day, and get 7–8 hours of sleep. Undergo regular health checkups. You should prioritize foods such as fish, eggs, white meat, chicken and duck, green vegetables, fresh fruits, and whole grains. Limit the following: fast food, sugar and soft drinks, alcohol, fried foods, and fatty red meat.